What if light could help your muscles recover faster, reduce fatigue, and even boost your performance? Sounds futuristic, right? But athletes around the world are turning to something called infrared therapy, claiming it helps them bounce back quicker than ever. The question is, does science actually back that up? We've all felt that post-workout soreness, heavy legs, tight muscles, the kind of fatigue that makes you want to skip tomorrow's training. You stretch, hydrate, maybe use an ice bath or a foam roller, but recovery still takes time. Recently, a new tool has entered the spotlight: far infrared light. You might have seen it in infrared saunas, recovery pods, or high-tech sportswear that claims to boost blood flow. Is it just hype, or is there real evidence behind it? Infrared therapy uses heat waves your eyes can't see but your body can feel. It comes in two main forms: far infrared, FIR, and photobiomodulation, PBM. FIR is the type used in saunas and special garments, while PBM uses red or near-infrared light from LEDs or lasers. Instead of heating the air around you, infrared light penetrates the skin and warms tissues from within, like the comforting warmth of sunlight on a winter day. This deep heat increases blood flow, helps clear out waste products, and may support cellular repair. In a 2016 study by Wiriawan and colleagues, PBM improved mitochondrial function, basically giving your cells more energy to heal and perform. So what does the research actually show? In a 2015 study by Noponen and colleagues, 10 power athletes used far infrared therapy during intense training. They showed higher jump performance, more power in the Wingate test, and even better testosterone to cortisol balance, a good sign of recovery. In a 2024 study by Tseng and colleagues, 24 elite female soccer players experienced striking recovery benefits. Muscle damage markers like creatine kinase dropped significantly, meaning they bounced back faster. Another 2024 study by Wiriawan and team found lower lactic acid and muscle damage after infrared therapy. These findings sound impressive, but there's a catch. A 2021 systematic review by Bastien Bontemps and colleagues looked at 11 studies and concluded the overall evidence is still inconclusive. Most studies are small, roughly 70 total participants across 4 main trials, and the methods differ a lot. The bottom line? Early evidence is promising, but we need larger, well-controlled studies to know for sure. How can light actually do this? FIR therapy helps regulate hormones like testosterone and cortisol, which affect recovery balance. PBM boosts energy production inside cells and reduces oxidative stress, limiting damage after tough workouts. Both types improve blood flow, bringing more oxygen and nutrients to sore muscles. In 2024, Wiriawan's study showed that FIR reduced lactic acid and oxidative damage after exercise. In 2019, Tomazzoni and colleagues found that PBM used before exercise improved VO2 max and helped protect muscles from damage. Whether used pre- or post-workout, infrared therapy seems to give your body's recovery systems a helpful push. Of course, no therapy is risk-free. Overexposure to infrared heat, especially when unregulated, can cause skin photodamage, as noted by Thereja and colleagues in 2021, while Xie et al. 2012 found it generally safe for cardiovascular health. Other studies advised against its use during pregnancy because of potential risks. As always, consulting a healthcare professional is the smart move before adding new recovery methods. For athletes interested in trying it, there are several ways to use infrared therapy safely. FIR saunas can be a great post-training tool. According to Ahokas et al. 2022, they reduce soreness and help restore explosive power after resistance workouts. FIR-emitting garments may help with thermoregulation and blood flow, supporting endurance and recovery. PBM lights or panels can be applied before or after training to reduce inflammation and support muscle growth, as shown in Ferraresi's 2016 work. And infrared imaging, described by Fernandez Cuevas et al. 2017, can even help monitor injuries and recovery progress. So what's the takeaway? Infrared therapy isn't a miracle, but it's definitely promising. Across small but consistent studies, athletes have shown faster recovery, less soreness, and better performance metrics. The field is still young, and stronger evidence will decide how effective it truly is. Next time you see someone relaxing in an infrared sauna, remember, they might not just be resting, they could be recovering smarter. If you enjoyed exploring the science behind recovery, give this video a like, share it with your training buddies, and subscribe to Physio Hub for more evidence-based insights into sports and rehabilitation. We help people live smarter and perform better with science.